Just a quick discussion about neck lifts. Obviously, people don't like having a turkey gobbler and this hanging down. And it varies what we do from patient to patient, how we can improve that. If you're younger and you have good skin tone and good muscle tone, I can just make an incision under here and do what we call a medial platysmoplasty, where I actually sculpt the extra fat that's above this muscle called the platysma and below the muscle called the platysma, and then tighten the platysma medially, and that's pretty much all they need. It's a pretty straightforward procedure. However, as we get older, things can change. It depends on your weight, your ethnicity, and basically your genes, how you individually age. So there are a lot of things that can come into play then. So a couple pearls. I don't like closed liposuction of the neck because the fat in the neck has to be sculpted. And the only way you can do that is by being a sculptor, seeing it. There's good fat, bad fat. You want the bad fat gone. You want the good fat to stay behind, or you can look overdone, what we call a cobra deformity. Plus, there's fat above and below the platysma, and it's very hard to get the fat below the platysma with a liposuction cannula. So if that's what your doctor is thinking of doing, I would advise against that. Secondly, you have to be able to know how to manipulate the platysma muscle. As we age, the muscle has to be not only manipulated medially but laterally. So as you get older, if we were going to operate on the neck, we're going to need some incision around the ear for me to get in here and do the work I have to do for the lateral platysma. There are other little tricks. Sometimes the parotid gland's too thick. You have to thin the parotid gland here. Sometimes the digastric muscle's too thick. You have to thin that. That's down in here. Sometimes there's a hanging submandibular gland that has to be trimmed. That's about right in there. These are all things that are individualized from patient to patient. Actually, one of the first doctors to publish shaving of the submandibular gland was me many, many years ago. And a neck rejuvenation. And I think we'll see if I can find my chapter real quick. There it is. Techniques for the difficult neck. It's in there if you'd like to read it. So that's about it. So some good, quick little pearls about neck lifts, and hope you found that educational.